Alright guys, let's talk about a second degree type 1 AV block. So what are some common findings in the second degree type 1? Well, what basically makes it up is that the PRI gets longer and longer until the QRS complex is dropped, and this usually follows a pattern, and this is also just food for thought. Something is usually reversible. Oftentimes this is seen as a result of an AV injury during an MI. So it's possible to see these blocks come and go while you're transporting someone with your nitroglycerin or your morphine administration, or with just some blood sneaking past whatever occlusion is going on there, okay? So how do you remember the different types, whether it's second degree type 1, second degree type 2, and all that good stuff? The best way to remember it is longer drop. That's what we call Wenkebach. And I know that is corny, but it will stick in your head if you say it a couple times over and over. So let's have a look at a rhythm strip. So here's a pretty classic second degree type 1. So the first thing you'll notice is that there are a couple of drop complexes here. There are some QRS complexes that should be there and are not. If you take the time to measure out the PR interval, you will see that it elongates over about 3 beats and then drops. This is pretty classic of the second degree type 1, or the Wenkebach, right, or what's also called Mobitz I. Another thing you want to notice is that the P to P interval here actually stays pretty constant and pretty regular. So that's another dead giveaway for it being a second degree type 1. So in order for that to be what's actually going on here, there can't be anything else going on. So what I mean by that is that everything else should be fairly normal, except the PR interval is marching out, that's getting longer, and then a complex is dropping, and this usually follows a repetitive pattern. And when you're looking at that, you know you're looking at a Wenkebach or a second degree type 1 AV block. Thank you very much.